Hello everyone and welcome to a new episode. Today we're going to delve into the science and practical application of oncology research for a better and healthier life for cancer survivors. My name is Ruben Odabashian. I'm an oncologist in training and I'm very passionate about educating cancer patients about their disease, prevention and treatment. My role in medical research and training at the hospital are separate from these videos and podcasts. However, this podcast is part of my passion and commitment to bringing absolutely free information about the science of cancer, and the latest research and applicable tools to the public. I believe that knowledge should be free and there should be no price tag, especially for sensitive topics like cancer. Today we're going to unpack the significant but under-discussed subject of how exercise can serve as a potentially help patients with cancer. So despite the importance of this topic, it often gets under the radar, resulting in many people being unaware of the potential benefit. Our discussion will be centered around the guidelines for exercise in the context of cancer, focusing on the type of exercise and amount of exercise that helps cancer patients. By better understanding these nuances, cancer patients can harness the power of physical activity, and this will help them in their recovery and enhance their lifestyle. Most of the content of this video is from exercise guidelines for cancer survivors published in the Medicine and Science in Sports and Exercise. I noticed that through my training, we do a great job in helping or prescribing, let's say, chemotherapies, immunotherapies, targeted therapies, but unfortunately, we are not well trained in helping cancer patients better managing their symptoms through lifestyle. Lifestyle includes exercise, diet, fasting, sleep, eating healthy, avoiding overprocessed foods. All these are very important, and that's my goal from this channel. I hope that I be part of your journey and I help you understand what you can do to help prevent cancer and the recurrence of cancer. Remember, your treatment team contains many players, right? Like you have your oncologist, your radiation oncologist, your surgical oncologist. There are many players in your team, but the most important player is you. You as the patient, you hold the keys. Oncologists can give you chemotherapies, radiation oncologist can kill the cancer with radiation, the surgical oncologist can do surgery, but there are things that you can do through lifestyle, healthy eating, exercise that are evidence-based that can help prevent cancer from its recurrence. To start our discussion about exercise, we need to define different types of exercise. First, aerobic exercise. It's known as cardio. Aerobic exercise is any type of physical activity that aims to increase your heart rate and move you from point A to point B. And that includes biking, running, brisk walking, dancing, anything that increases your heart rate. And this will help also with your endurance. So this is number one. Number two is resistance exercise. Resistance exercise, also known as strength training, weight training, it involves improving muscle strength and endurance by making your muscle lift heavier objects. And that includes either like the dumbbell or the barbell in the gym or your own body weight. Regular resistance exercise help to build your strength and your body will become adapted of moving objects and lifting objects. Now, let's talk about supervised and unsupervised exercise. Supervised exercise is when you do exercise with exercise physiologists or physiotherapists, people who are trained to help cancer patients or patients in your situation exercise and do things under supervision, and they give them exercise program. They monitor their progress and they adjust the program as needed. Unsupervised exercise, it's a physical activity that is performed independently without any supervision. It can take place in the home or in the gym or anywhere. So when you do unsupervised exercise, the downside is you can't monitor your progress, you don't know what you can do and what you can do, and there is a chance of hurting yourself. But also, I understand that supervised training programs are very costly and not everyone can pay for them, and sometimes not covered by insurance. Why exercise is important? The population of cancer survivors is expanding. In the United States alone, there are more than 15 million people with cancer. They are cancer survivors, okay? And this number will multiply by 2 or 3 by 2040. On the other hand, the advances in healthcare leading to improved survival rates also highlighted the growing needs to tackle the distinctive health challenges that cancer survivors face. Okay, so this arises from the cancer itself, the treatment, and the complication of the treatment. There is also another symptom that cancer patients experience is fatigue. 25% of cancer survivors experience fatigue. This could be related to the cancer, its complication, the treatment, its complication. And this can affect the independence of those people. On the other hand, there are many cancer patients who also have cardiac conditions, and lots of treatment that we use in cancer can affect their health. So to summarize, the number of cancer survivors is increasing. Okay, lots of cancer survivors experience fatigue. Many cancer survivors have underlying cardiac problems, and they will experience cardiac problems due to the treatment that we give. Okay, so all this makes exercise very important, and the lifespan as well of cancer patients is increasing. One of the most common questions that I get in the clinic is, can I exercise or not? This is a very tough question because it truly depends on your overall health before being diagnosed with cancer. The current treatments that you will take and what modalities your oncologist is using to deliver this treatment and how this treatment will affect you. Let's say if you were a fit patient and you tolerated the treatments very well, the chemotherapy or the immunotherapy, and you did not experience any side effects, and you are not using any ports to give you chemotherapy, you can probably continue doing the same exercises that you did before your treatment. On the other hand, let's say you did not exercise before your cancer treatments or before your cancer diagnosis. Also, let's say the cancer treatment that is being delivered, it needs a port, okay, or it needs an access. So sometimes we put a port, which is like it's a catheter that goes from the chest to the major veins, because the cancer treatment that we give, it causes irritation. If you have a port, or if you did not, or if you are not fit, or if you have underlying cardiac problems, the answer completely change. Okay, so here, like, it's very important to talk to your oncologist, to talk to your cardiologist, and see if you are fit to exercise during treatment or after the chemotherapy itself. And also, it's very important to do a supervised training program where someone supervises you while you are doing exercise and make sure you progress slowly and don't go fast. So to answer the question, is exercise safe for me as a cancer survivor? This really depends on your overall health. It really depends on your overall condition before being diagnosed. Then it depends how the treatment affects you. Some people, when they are on the chemotherapy, they completely lose their energy. It depends on what modalities your oncologist is using to deliver treatment. It depends how you tolerate that treatment. Are you a person who is developing nausea, vomiting, diarrhea? Are you a person who is tolerating the chemotherapy well? So there are many factors. My answer would be, talk to your oncologist, talk to your healthcare provider, and ask them for their advice. Now let's talk how exercise can help cancer survivors. Cancer survivors experience a wide range of symptoms. The most common being anxiety. I see lots of patients in the clinic when they come for follow-up after they were treated from their cancer, and we do like scans on a regular basis. For example, like for colon cancer patients, we do CT scans or we do colonoscopies. They have anxiety around that. They have anxiety before undergoing the test, and then they have anxiety until they wait the results for the test or like talk to their oncologist to deliver who is going to deliver this news to them, right? So anxiety is a very common symptom. Depression. The word cancer makes people so depressed. Unfortunately, there are still some cancers that we don't have treatment for, but that being said, there are lots of cancers that we can treat. And some cancers are being cured in this day and age. But the public doesn't have lots of knowledge about this. Many patients, when they hear the word cancer, they just become depressed. And this is understandable. Like, this is very heavy diagnosis. Your life is going to change. And life is not as it used to be. You're always going to have that in the back of your mind. So depression also is a very common symptom. Fatigue. Fatigue is a very common symptom that cancer patients experience, and it could be related to the cancer itself, it could be related to the treatment itself, it could be related to the complications, it could be related to anemia, it could be related due to decreased nutritional intake. There are many causes. Some cancers, for example, patients with breast cancer, if they have surgery and they remove the breast, they have lymphedema. So there are wide range of symptoms that cancer patients experience. But based on randomized clinical trials and systematic reviews, we found that exercise can help different symptoms in cancer patients, and different types of exercise can help cancer patients in different ways. So first, let's talk about anxiety. Anxiety is a very common symptom that cancer patients experience. It could be they had anxiety before being diagnosed with cancer, or it could be they developed anxiety during their cancer diagnosis because they are always anxious about receiving news. So studies show that moderate intensity exercise, aerobic training exercise, 3 times per week for 12 weeks, or a combination of aerobic and resistance training. For example, going for a run and lifting weight. When this is done twice weekly for 6 to 12 weeks, can significantly reduce anxiety in cancer survivors during and after their treatments. But that being said, resistance training alone, going to the gym, lifting weights alone, hasn't been shown to help reduce anxiety in cancer patients. Remember, this comes from randomized clinical trials where we have 2 groups. Group A do aerobic training, Group B do weight training, and then we take the average, for example, of Group A, and we take the average of Group B. So this is the average of thousands and thousands of patients that we study. You might be a person who goes to the gym and you enjoy that. You lift weights and you just feel better. That relieves your anxiety. Does that mean you should go for a run if run is not benefiting you? No, that's not right. If lifting weights is making you feel less anxious, go for it. But if you're not benefiting from lifting weights, try going for a brisk walk, a dancing class maybe, running, biking, swimming, anything that increase your heart rate. Because based on the guidelines and based on the evidence that we have at this time and this point at this time, weight training alone doesn't help with anxiety. Something else also about anxiety is it is unclear if there is a dose-response relationship, meaning whether changes in anxiety levels are directly tied to the intensity of the exercise. It looks like anxiety tends to improve with exercise, but as we increase exercise, that doesn't translate to more decrease in anxiety. And I think my sense from the clinic, so this is my opinion, it's not based on the guidelines, people who feel anxious around their cancer diagnosis and treatment will always have that anxiety because it is generated secondary to the ideas and the thoughts about, okay, so I will have the treatment, what's going to happen? Is this kind of cancer is going to recur or no? Am I going to have a cancer recurrence on my CT scan? Is my blood test going to test positive for cancer? Am I cancer? So always there is that anxiety-provoking thought and fear about cancer recurrence or cancer worsening or not responding to treatment. In my opinion, that's why I think that as we increase exercise levels, that does not translate to more reduction in anxiety. But if you're feeling anxious, right, that doesn't mean that you should not go for a run or a brisk walk or a bike or a swim. That will help you reduce your anxiety. And it is also noted that in the clinical trials and guidelines that people who do supervised training programs, they have better results than people who exercise independently. Because when you do it with, under supervision with people who know how to help cancer patients to exercise, okay, those people are monitoring you, are giving you the right treatment, are providing you with the right feedback, and you will always have that motivation to show up to training because you are being held accountable versus when you do that by yourself. Now let's talk about depression. Depression is very common in cancer patients. Again, it could be related to the diagnosis itself. It could be related to the treatment. When you're being treated with cancer, unfortunately, it's not, some cancers, like you take a pill once or twice a day and that's it. But many cancer treatments still depend on chemotherapy. And for chemotherapy, you have to come to an infusion center or chemotherapy center where they can hook you to an IV line and they're going to give the they're going to give the chemotherapy. So that can also trigger a depression because like it does take some time from your day. Many cancer patients also experience financial toxicity. Unfortunately, cancer diagnosis and cancer treatment comes with financial toxicity where patients have to quit their job, stop taking care of their families in the 4 or 5 hours where they have to come to their treatment, right? So those financial toxicity also can lead to depression. But that being said, based on the guidelines, aerobic training of moderate intensity exercise done 3 times per week for at least 12 weeks, or a combination or a blend of aerobic and resistance training carried out twice weekly for 6 to 12 weeks can significantly decrease depressive symptoms in cancer survivors during and after treatment. Same with anxiety. Weight training alone does not help with depression symptoms. Again, I will repeat the same thing that I said about anxiety. If you are a person who feels depressed and you go to the gym, you lift weight, that helps you, that doesn't mean it's wrong. Keep doing it. But if you're not seeing a benefit from weightlifting and training at the gym, give it a try. Go for a brisk walk, go for a dance, go for a run, go for a swim. Now, unlike anxiety, where, as I said, in anxiety there is no relationship between the amount of exercise and the reduction in anxiety, depression is a bit different. So based on results from high quality trials, aerobic training and depression, between aerobic training and depression, there is a dose response effect. That means the larger the amounts of aerobic training, the more decrease in depression. People who exercise 90 minutes per week versus people who exercise 180 minutes per week, they will experience less effect from exercise under depression. That being said, in simple words, the sweetest spot, it looks like you have to train yourself or you have to exercise for around 180 minutes per week, okay? Not 90 minutes is not enough to see that response. Same with anxiety. Depressive symptoms seems to be more noticeably decreased in supervised training programs or those who exercise with a trainer, where there is an element of supervision compared to programs that are largely unsupervised or carried out at home. Now let's talk about fatigue. Fatigue is a very common symptom that cancer patients experience. As I said earlier, okay, so they can feel tired because of the treatment. I see lots of patients when they come to the clinic and they are on the chemotherapy, like we see them on a regular basis, and the first couple of days of chemotherapy, they just feel so tired. They go to bed, they sleep, they spend the entire day sleeping, and then the next week after chemotherapy, their body perks up and they have energy again. Or the fatigue can be secondary to depression. So people who feel depressed, one of the side effects, one of the symptoms of depression, one of the criteria of diagnosing people with depression is fatigue and low energy. Fatigue could be related to decreased nutritional intake. Fatigue could be related due to anemia. So it's very important if you're experiencing fatigue to talk to your oncologist and tell them about what you're experiencing, because there are tons of causes of fatigue. Also, you're going to notice that your oncologist might give you steroids during your cancer treatment to boost up your energy. There are many other treatments that your oncologist might give you to help boost your energy, or if you are losing weight, they might refer you to a nutritionist, or if you're anemic, they might transfuse you blood. So there are many reasons, and treating the primary cause is the main treatment. But that being said, if you're experiencing fatigue and you want to improve that fatigue through lifestyle, for training, so what you can do is you need to exercise, moderate intensity, aerobic training, 3 times a week. It can significantly lessen cancer-related fatigue, both during and after treatment, and this is important. You can also do some aerobic training and weightlifting, just like depression, just like anxiety. Moderate intensity combined aerobic and resistance training sessions 2 to 3 times per week over a 12-week period can also help with the fatigue. Just like depression, where we saw some relationship between the amount of exercise and the response, fatigue also has that similar effect. The effect of exercise is the strongest for moderate to vigorous intensity exercise. Low intensity training doesn't have that great effect to improve fatigue in cancer survivors. That being said, fatigue reduction is greater with exercise sessions longer than 30 minutes and programs that last more than 12 weeks compared to less exercise. So the bottom line is aerobic exercise help with fatigue, weightlifting help with fatigue, and the effect is seen when the exercise training session is more than 30 minutes and lasts the total duration more than 12 weeks. And once you get to the routine of exercising, you will just get used to that dopamine effect in your brain. You're just gonna love it. Several years ago, I didn't really love exercise. I hated exercising. I still sometimes wake up in the morning and I just don't want to go to the gym. I just don't want to go for a run. But it's not the feeling it's not what I feel during the run that makes me go for a run or a bike. It's the feeling that comes afterwards. Okay, the feeling that come after going for a run, coming back home, and taking shower. That feeling is very, very, very addictive. And for me, I'm a morning person. I wake up in the morning. I avoid looking at my to-do list. Like any normal human being, I might take a look at my phone, right? It's very important to resist that, but sometimes you just can't. Okay, so you want to take a look at your phone. You're going to see if anyone called you overnight or whatever. But I don't look at my to-do list. I noticed that for myself, when I look at my to-do list, the first thing I'm going to experience is anxiety because I have tons of things to do. By the way, I'm a very anxious person, right? So I avoid looking at my to-do list. And I try to exercise first thing in the morning. Coffee, exercise, shower. And the feeling of happiness and the feeling of that energy that comes after the exercise, during and after showering, is what my brain craves for. Now let's talk about lymphedema. Lymphedema is swelling that happens in the arm or in the leg. This usually happens because during surgery we remove the lymph nodes. Okay, so let's talk about basic science now. Let's talk about how circulation usually happens. Okay, so let's talk about my arm. Okay, so my heart pumps the blood toward my arm, and that blood is going to circulate, and then that blood is going to come back toward my heart. So arteries take blood toward the organ, veins return the blood from the organ. When the blood circulates in those vessels, some of the blood will leave the vessels and go toward the tissues to bring nutrition, to bring oxygen, to bring minerals, and etc. Right? And that fluid that left the vessels and went to the tissues is going to be brought back through lymph nodes and lymph vessels. So the main function of the lymph nodes, of the lymph vessels, is to bring the fluid that left the arteries and veins and is sitting in the tissues. Let's take an example, breast cancer patients. Okay, so what happens in breast cancer patients is after the surgery, we also remove the lymph nodes. We also remove the lymph nodes and lymph vessels. So that will block that lymphatic drainage. And that fluid that used to be removed by the lymph vessels and the lymph nodes is just going to stay there. And that's why you see lots of patients who have breast cancer, they have asymmetric swelling in their arms. Okay, or sometimes patients who have like abdominal surgeries and or like prostate cancer and some lymph nodes are removed that can impede or affect the lymphatic drainage, right? So the swelling in the arm that happens after surgery due to accumulation of fluid, it's called lymphedema. In the past, the clinical recommendations have advised against aerobic or resistance training to prevent the onset or the worsening of the lymphedema. Okay, back in the days, doctors told patients, don't exercise, don't do resistance training, don't do aerobic training, because this will not help with the lymphedema. Now things change, okay? Evidence-based exercise helps improving the lymphedema and decreasing the lymphedema. It does not prevent the lymphedema from happening. If you are a breast cancer patient who had surgery and you develop lymphedema, okay, so exercise can help to reduce the lymphedema, but it will not prevent it from happening. So when it comes to lymphedema, resistance training, slow and steady program, focusing mainly on large muscle groups, carried on 2 to 3 times per week under supervision of a fitness professional, a physiotherapist. It is safe. So if you have a lymphedema, you're going to notice that, or your oncologist is going to tell you, or going to refer you to a physiotherapist. This helps to reduce the lymphedema. The most important thing when it comes to the lymphedema, you have to start low and progress slowly. Right now, there isn't enough evidence to say that unsupervised training program might help with the lymphedema movement. But that being said, I know that not everyone have access to physiotherapists. Sometimes the insurance don't cover it, or sometimes patients can't afford it, especially with all the financial toxicity that comes with cancer treatment. Also, it looks like running and like aerobic training doesn't help with lymphedema, but that being said, it doesn't make it worse. And most of the data that we have about lymphedema comes from breast cancer survivors, because these are the patients that develop or mostly develop the lymphedema. Sometimes it can happen with other types of cancer, but breast cancer patients are the ones who most develop the lymphedema. This is the end of today's episode. I hope this discussion about the importance of exercise in your cancer journey have given you some new perspective and some valuable insight. Remember that most of the content of this video is based on exercise guidelines for cancer survivors published in the Medicine and Science in Sports and Exercise. This is not a medical advice. It's very important to talk to your oncologist before you start the exercise program, or a physiotherapist, and also if you have a nutritionist or a dietitian in your team, also involved in the discussion early. Also very important to understand your body and how exercise can have a very positive impact on your health as a cancer survivor. Stay active, stay informed, and most importantly, take care of yourself. My name is Rupen Odabashian, and it's been a great pleasure to be part of your journey, and I will see you in the next episode.